I'm Joetta Maier, one of the Associate Program Directors here at Kaiser Santa Clara, and I wanted to talk to you guys for a few minutes about our Choice Outpatient Program and also briefly our Community Health Program. So just a little bit about me. I'm in charge of the outpatient side of the residency here. So if you come here, I will be helping you with your continuity clinics and also the preventative care of your patients. I'm the director of the Choice Outpatient Program, and along with my buddy Joe Vu, who's filming right now, I help direct the Community Health Program. So just to give you an idea of why we made the decisions that we did, I actually came here initially as a hospitalist and then switched after about 5 years to primary care. Love them both, but learned some interesting things. One is that most residencies are very inpatient based. I think a lot of residents make the decision to go into hospital medicine mostly because that's what they know. And it's important to me that you guys have a very balanced education so that whatever decision you make, whether that's hospital medicine, primary care, specialty, you make it fully having experienced all of those. Another thing that I learned is that, again, whether you go into hospital medicine, primary care, most folks end up gravitating towards developing a specialty of some sort within their area, whether that's as a hospitalist, specializing in the care of post-cardiac patients, as a primary care doc, maybe that's specializing in the care of weight loss patients, because it's really important for job satisfaction to have a little bit of variety in your job. And it was important to me to create a program where folks could develop that specialty during their training, so that as soon as they go out into the workforce, they have something extra to offer and a little bit of variety already built into their job. So about the Choice Program, the chiefs have discussed kind of the nuts and bolts already, so I just wanted to highlight some things that are different about the Choice Program. For one, it's really for anyone who wants to work eventually in the outpatient setting. So whether that's as a primary care doc or as a sports medicine doc or rheumatologist or geriatrician, if you think that your career is going to be in the outpatient setting, let's let your residency be primarily in the outpatient setting. So approximately 2/3 of your training in the Choice Program will be in the outpatient setting. Some things that you will do with that additional time. Number one, the areas of distinction. So as I mentioned, developing a specialty within your chosen profession, I think, is really important. So if you are planning to be an outpatient specialist, you might spend that extra time and develop your expertise in an area related to your fellowship. So if you want to be an endocrinologist, you might choose to develop an area of distinction in diabetes, for example. If you're going to be a primary care doc, you might want to specialize in lifestyle medicine, get certified, board certified in lifestyle medicine while, becoming board certified in internal medicine. If you're going to be a sports medicine doc, you might want to specialize in musculoskeletal medicine. The areas of distinction, they involve a certain number of hours of additional education in that area, a certain number of hours of clinical training in that area. We give you a mentor, we have you do a research project or PI project in that area. If you have any questions about any of those, please feel free to email me, ask the chiefs. Another thing that the Choice residents do is they spend a lot of extra time in our free clinics, and I'll talk about that in a second. And in addition, the Choice residents are all expected to do some leadership activities. So they do the leadership electives, which we have set up, and they all take on some sort of leadership role in the residency. They also become tech experts. So all of our Choice residents do extra training with our technology experts here on campus, and become what we call super users of Outpatient Epic. They help train younger residents, and a lot of them after graduation have gone on to become tech leads within their eventual departments. So that's it for the choice program. Just a few words about our community health program. So the chiefs have talked to you a little bit about the clinics that we are rotating through. Here we're going to expect all interns to do 2 weeks in the free clinic of their choice, all second years to do 2 weeks, and third year will be voluntary for categoricals, but the choice residents will be expected to do at least 2 weeks in their third year as well. That being said, anyone is welcome to do more, whether they're choice residents or categorical residents or prelims. We have the capacity in the free clinics for people to do as much as they want. Some people may choose to do a continuity clinic at the free clinic in addition to the free clinic or to the continuity clinic that they do here, and they're more than welcome to do that. In addition to the free clinics, we also do a number of outreach talks, including at homeless shelters, nursing homes, and at the Apple campus. So any questions about those, please feel free to ask me, ask the chiefs, ask the residents, and best of luck with interview season.